Next, we'll be looking into force field analysis. A force field analysis allows us to look at driving factors of change. Some factors are for the change, while others are opposed to the change. In my particular scenario, I think that the implementation of an electronic charting system, which requires both the patient and the medication to be scanned prior to administration, would be a great change. So forces for it. This can result in improved patient outcomes, which is great, and it can decrease the risk of medication error. An electronic charting system is a double check for medication administration. Now, the nurse is responsible to perform the 5 rights of medication administration, but it doesn't hurt to have an electronic charting system that can verify the medication in hand against the ordered physician order. And the third is ease of use. It is found that once people are properly trained on new technology, it can provide some ease of use and can make the job easier for these nurses. Some factors that would be opposed to the change. The expense of a new charting system. In order to implement a new charting system in a hospital or any type of medical facility can be costly. So depending on budgeting, administration may not be for this type of change. Training of the staff. In order to implement a new electronic charting system, staff would need to be properly trained for this. That means that you would have to have people trained to train other nurses. You would have to have the availability to remove some nurses and medical staff from the floor in order to provide them with the adequate training that they'll need to implement this new charting system, all of which can be costly and may not be feasible if there is already a staffing shortage. And then the last is reluctance to change. Sometimes people are just opposed to change because it's change. The idea of something new, a change in their regular system, it causes fear, and people do not like to try new things, which can be a great burden when you're trying to implement something new that can actually be beneficial to the patients.